Hello, everybody. It's me, Karma. I'm doing a little bit of a different format for my video, just trying something new. Um, if you've never watched me before, this is an update on my GoFundMe. Again, I'm raising money to be able to afford to get my reconstruction on my breast finished from when I had a double mastectomy after I was diagnosed with breast cancer. And as I've done the GoFundMe updates, I've just realized that there's a lot of unawareness about breast cancer and what exactly goes into it when you're dealing with breast cancer. Everybody knows, that you need to go in and do mammograms and get checked for breast cancer. People understand that you might have to do chemotherapy, but beyond that, I don't think a lot of people understand everything that's involved in it. So, just a little bit of figures and statistics. 1 in 8 women are diagnosed with breast cancer. 40,000 women a year die from breast cancer. It is a very serious disease. Over 230,000 women are diagnosed each year. Um, After you get diagnosed, you have to figure out what course you're going to take to treat your breast cancer. Now, you have options, but I think the majority of women, I want to say 100%, but I don't really have a statistic for that. But the majority of women that get diagnosed with breast cancer have some sort of surgery on their breast to remove the cancer. And that would be in addition to if you had to do chemotherapy or radiation. Now, I was lucky and I caught it on my very first mammogram. They caught my cancer. And when they told me that I was positive for it, I immediately decided that I wanted to have a double mastectomy. Now, you can have what they call a lumpectomy, which is where they go in and they remove a piece of the breast where your cancer is actually located. Or you can have a mastectomy, and that's where they remove the whole breast. Now, I had a double mastectomy because I did not want to take any chances of my cancer coming back. So what that means basically is that they removed both of my breasts. Now, you can choose to have a mastectomy and just stay flat, or you can choose to have a mastectomy and do reconstruction, which is what I chose to do. And honestly, when I made that decision, in my mind, I thought that reconstruction would be an awful lot like just getting a boob job. But it really is not. You have to, when they remove all of your breast tissue, and then all you have is skin and your chest muscles. So what they do is they put these things in called expanders, and they're like little pockets, and they put them in underneath your chest muscle, and then they fill them up with saline, and they keep filling them up periodically to stretch your chest muscle out until it's large enough for you to put an implant in. So I did not have good luck with that. My body rejected the expanders twice. I got bad infections, had to go in and have everything surgically removed and then cleaned out and put back in. The second time they put small implants in instead of the expanders. But I persevered. It's a process. It is not quick. About a year after my mastectomy, I was nearing the completion of my reconstruction, and I was probably at about a C, probably maybe even closer to a D, but right at that borderline. And I went in for what they call a fat fill, and they take fat from your belly, not a whole lot, just a little bit, and they put it in up here on your chest, and then it's supposed to kind of go down and fill in the space between your skin and your chest muscle because you don't have breast tissue anymore. Well, I got a serious infection from that. I had to go in and they had to remove everything, didn't put anything back. I was in the hospital for 4 days. I came home on IV antibiotics for 2 weeks. That was pretty scary. So what I'm left with now, I don't know if you can see, this is it. This is what I have. It's very small. I was probably close to a triple D before I got diagnosed, and I don't even really know what size you would call these. Um, they're just baby boobs, but I'm I don't I don't even have cleavage, but I'm not complete. It's not even so much just about the size, although the size is kind of sad. But for me, it's more that I don't have nipples. Um, Scars I expected, but I have like folds of skin because the implants that they put in are very small and they're not as big as the plan was for me to have, so they don't fill up the skin that I have left. So, like, you see, I have folds of skin that are not filled in. And I just, when I was going through all of this, I've kind of felt like maybe I was the only one. You get kind of tunnel minded when that's happening. But statistics say about 35% of people doing reconstruction do get the infections. And so I know I'm not the only one dealing with it. I've, met people along the way that have, helped me realize that this is not as uncommon as I thought that it was. So, yeah, so that's what I'm raising money for. But I just kind of want for people to be aware of it. Anybody that you know that is a breast cancer survivor has gone through some sort of surgery on their breast. Some people have had really good experiences. Some people are complete and they're satisfied with it. But a lot of people are not. And a lot of people are dealing with some emotional baggage behind that. And I know that to some people it might seem kind of trivial maybe, because honestly I do realize the important thing is to be cancer free. But as a woman, your breasts are kind of tied up into who you are as a woman. And I don't know how to make that sound not weird, but not having breasts is very hard to deal with and still feel feminine and attractive. So that is another big part of the problem that a lot of women deal with, and it's not something that's spoken about. It's not something that you hear about when you hear people talk about breast cancer awareness. And so I just kind of wanted to put this out there where more people could see it, where more people could be aware that this is a problem, that everybody that is dealing with breast cancer has dealt with in some way, shape, or form. Some people have a much better attitude about it than others. Some people are really, really depressed about it. For some people, it destroys their relationships. I've heard women talk about their husbands leaving them as they went through this process because they felt so unattracted to them. So, I just wanted to address that because I've had people ask me about it in a way that makes me feel like they think that I'm being trivial for what I'm trying to do, but it's really not a trivial problem. Anyway, if you got this far, thank you for listening to me. Donate to somebody. If it's not to me and my fund, donate to the breast cancer awareness people. Donate to Relay for Life. Donate to somebody that you know. Just, let's all be kind and let's all think about what other people are going through. And thank you for listening. And my GoFundMe will be in my comments below if you're watching this on YouTube. And if not, I'm going to attach this to a GoFundMe link. And I hope you share it. That's the most important thing. Get it out there. Let people hear what kind of things you deal with when you're going through breast cancer. Maybe somebody that just got diagnosed will hear this and it'll be something that'll help them out. I'm going to try to think of some other more inspiring things to talk about as far as that goes. But this is just my first video, and thank you very much.